You already know that from pelvis renalis, ureter goes to urinary bladder. And that is urinary bladder. And ureter has abdominal part that is from the beginning to place where ureter goes into true pelvis. It's attached to linea terminalis. Who remember linea terminalis? Where is it? In pelvic bone. It consists of linea arcuata, then pectinosis pubis, ramus superioris pubis, and pubic symphysis. That is on the border between large pelvis and true pelvis. That is linea terminalis. From the beginning to linea terminalis, we speak about pars abdominalis. That is first. Second is pars pelvina in true pelvis. And last part, in wall of urinary bladder, it is near of 2 centimeters in urinary bladder, that is pars intramuralis. 3 departments in ureter: abdominal part, pelvic part, and pars intramuralis in urinary bladder. Then ureter has 3 flexura. First flexura in the beginning, flexura abdominalis. Second flexura marginalis in place where ureter attached to linea terminalis. And last flexura near of urinary bladder, that is flexura vesicalis. 3 flexura. Then ureter has 4 constrictions. First constriction in the beginning, second constriction in linea terminalis, third constriction in pars pelvina, here it is, and last constriction in pars intramuralis. Wall of the ureter has 3 coats. External coat, that is adventitia. Ureter not supplies with peritoneum. It is behind of peritoneum. Between ureter and peritoneum we have fat tissue. That is why ureter has retroperitoneal position, the same like kidney, retroperitoneal position. Second coat, that is muscular coat, tunica muscularis. It consists of longitudinal and circular muscles. And pars intramuralis has 3 layers of muscles: external and internal, longitudinal, and middle is circular. And last coat, that is mucous membrane, tunica mucosa. And last, topography of the ureter in true pelvis. First of all, in place where abdominal part continues into pars pelvina, ureter attached to large vessels. They are common iliac artery and common iliac vein. It passes in front of these vessels, in front. Then, in female, ureter pass near of free border of the ovary. Then it continues at the base of broad ligament, laterally from the neck of the uterus. It is very important to remember, because in time of operation in uterus, sometime when we cut broad ligament, sometime it is possible to cut ureter. That is very important to remember, topography of ureter in true pelvis. In male, ureter pass near of seminal vesicle and deferent duct in space between rectum and urinary bladder. Next, bladder, urinary bladder. It has base, and base of urinary bladder continues into the neck, cervix, vesica. That is base, and base continues into the neck. And neck of the urinary bladder has internal opening, ostium urethra internum, and here it is, we have sphincter, musculus sphincter urethra internum, internal sphincter. Then here it is apex of urinary bladder, And from apex we have ligament which continues to umbilical ring, that is ligamentum umbilicale mediana, ligamentum umbilicale mediana, that is in place where urinary duct of fetus take place, that is urachus. And peritoneum supplies this ligament and forms fold of peritoneum, plica umbilicalis mediana. Bladder has two surfaces, anterior surface and posterior surface. Look here, if we make sagittal section of true pelvis, here it is pubic symphysis, that is urinary bladder, here it is urinary bladder, and that is urethra. And here it is apex of urinary bladder, and apex of bladder is, and whole bladder is behind of pubic symphysis. And you remember that in female, here it is uterus, that is vagina, and peritoneum from uterus goes to posterior wall of urinary bladder, and from apex of urinary bladder goes to anterior abdominal wall. And if urinary bladder is empty, it is not above, or it is behind of pubic symphysis, but full, if urinary bladder full with urine, it goes upward. And in this case, anterior wall of bladder may be above of pubic symphysis, and here it is peritoneum is absent. That is why it is possible to make punction of urinary bladder and remove urine from urinary bladder if it is impossible for passage of urine through urethra. Mucous membrane of, that is why bladder, urinary bladder has extra peritoneal position. Posterior wall of bladder supplies with peritoneum. Then muscular cord has 3 layers, but 3 layers of muscles together forms muscle musculus detrusor urina, musculus detrusor urina, that is expelling of urina muscle. And mucous membrane of bladder has a lot of folds. These folds in different directions, the same like in stomach, but one place of bladder, of urinary bladder, have not got folds. That is triangle of urinary bladder. In triangle, folds are absent because here it is submucous layer is absent. All in other parts of urinary bladder has telesubmucosa, and mucous membranes makes folds except triangle, except trigonum vesica. This triangle, apex of triangle in ostium urethra internum, and base of triangle, that is in place where ureters opens into the bladder, ostium ureters here and here, and fold between these openings of ureters, here it is at the base of triangle, that is plica interureterica, and fossa behind of this fold has name fossa retraureterica. And last, female, only female urethra. Female urethra, that is short tube, which start from urinary bladder and opens into the vestibule of vagina, vestibulum vaginae, in space between labia pudendi minoris. Urethra pass through muscles of perineum, and here it is transverse musculus transversus perinei profundus, deep transverse muscle of perineum, surround urethra and makes external sphincter, musculus sphincter urethra externum, internal sphincter in the beginning, in ostium urethra internum, in urinary bladder, and internal sphincter is involuntary because here it is smooth muscles, and external sphincter of urethra, that is voluntary because striated muscles forms this sphincter. 12.